Hi, everyone. Thanks for joining me here on Mom Squad, the show where we talk all things parenting. And I already had this interview scheduled 2 weeks in advance, but the day before we recorded it, I took my kids to the dentist. We went from being a cavity-free household to scheduling 4 fillings. And to top it off, the dentist told me I'm already late in getting my 9-year-old into braces. So maybe you're in the same boat, because in my friend circle, we are all asking, are braces necessary, or is this a money grab? Luckily, my guest has a lot of insight on all of this. I sat down with Dr. Susan Maples. She's a parenting expert, public speaker, author of the book Brave Parent: Raising Healthy, Happy Kids in Today's World. But she's also a clinician and dentist. So we wanted to ask about everything from preventing cavities to whether or not your 7-year-old really needs that first round of braces. She and I talked about how she considers overall health directly related to oral health in kids.
You know, I think the world is getting the message that it all begins in the mouth, and there are so many components of the mouth. It's interesting that in the late 1700s, when we divided the body up into systems and gave all the specialists their own system, they gave the mouth to the dentist, but it's the one area they don't teach in medical school, which is odd. So we have a lot of barriers to cross to try to integrate it into some understanding for physicians and to understand what are the telltale signs that we see that make a big difference. But not only can we use the mouth to detect major problems like metabolic disease, heart disease, all kinds of infection, but we also can really understand better now how the bugs in the mouth that overgrow, especially the dangerous bugs, end up everywhere you don't want them. The brains of Alzheimer's patients, the clots that cause heart attacks. And because we're able to track the source of the bacteria, the DNA of the bacteria is sourceable. We know now that these bugs come from the mouth.
That's wild. I want to talk specifically about kids. And actually, our interview is coming at a really good time because I feel like I've always had good oral hygiene. I have 3 kids, and the first 2 have passed all of their dental exams with flying colors. And then just last week, my youngest, she goes in and they said, well, she has 1 cavity and then she has 3 starting. And I'm thinking, I did the same thing with every single one of them. And she is actually my best at brushing her teeth. And I thought we were doing a good job. And here we are, where I'm taking her back in. We're gonna get a filling. And I'm thinking, what did I do wrong?
You didn't do anything wrong, but the microbiome in her mouth is different from the other kids.
And that was a big question, because I even asked them, is it hereditary or is there a difference in
No, it's not the fact that the teeth are soft or that they inherited soft teeth, but but she got some overgrowth of a bug called strep mutans. This is a bug that eats sugar and produces acid, and actually it flourishes with sugar. And there's sugar in everything. There's hidden sugar in everything, right? We're eating 22 to 40 teaspoons of sugar a day without even realizing it, and drinking it. So so one of the things that you notice is that when we are born, we're born relatively sterile, although we pass through the vaginal canal and pick up the colorectal bacteria and pick up the bacteria from the skin. And I don't know if you realize this, but we house 11 bugs per human cell. We're rich with bugs, and the more diverse, the better. One of the bugs that they don't get from the colorectal or vaginal canal or even the skin is the strep mutans. They get it from saliva, from caregivers. So if anyone who's cariogenic, cavity prone, gave her a nice sloppy wet kiss or sucked off her pacifier or wiped her face with a finger and introduced this as a child, then she would have had more of it. And of course, if she has a propensity for sugar, she can really activate that.
That's interesting.
Frequency of sugar, especially, not the amount. So she could go through, a couple years where she's popping in an M&M every so often throughout the day and really activate that acid production.
And that's interesting to me because it's something we don't think about. Like, obviously we're going to kiss our babies, and they had asked me, are you guys sharing drinks? I don't think so, but it's so hard to keep things out of baby mouths. So how do we?
Are you cavity prone?
No, not at all. I actually do not have any fillings, but my husband, that's a different story.
Right. So that may have been the case as well, or any
Mm,
caregiver could have been a different. We consider that window of infectivity 6 months to 3.5 years old, which it makes a big difference in the long run.
interesting.
Um, Microbial diversity in kids is depleted in all of us about half in 50 years. And when we suppress a whole bunch of different bugs, others overgrow. So that's changing a lot. And a lot of it's because of ultra processed food and because our food supply is narrowed down. 75% of what we eat is from 12 species of plants and 5 species of animals.
Mhm.
So and the ultra processing itself of food has created a microbiome issue. So we now see 20% of 2-year-olds and a third of 3-year-olds with tooth decay, which is why we need to see kids under the age of 1 to get this message across to parents about the transmissibility of this bacteria, as well as many other ways that we can help parents set their children up for a lifetime of oral health and systemic health.
So in those cases where, especially with like my daughter, for example, something happened, she got that introduced into her mouth at a young age. So is damage done, or what is it that I can do as a parent to now make
Really
sure
good
that
question. There's a great book out by a friend of mine, Kim Kush, who owns a company called Carry Free, but it's a really good carryology book for the public. It's called Why Me? And that's a perfect title, isn't it? Why
Yes.
her instead of the rest of your kids or you, right?
Yeah.
And there are definitely some things we can do to shift that microbiome. Certainly fluoride is helpful. To help protect the outer layer of tooth, as well as if she's young, getting it systemically so that we're building fluoride-rich enamel to help affront that. But besides that, we are also proponents of, taking a good look at sugar frequency, reducing, increasing putting in a neutralization for saliva. A lot of what we drink, I'm drinking right now bottled water because I'm in Colorado to give a conference, and the water from the tap smells funny. And I'm a big tap water person, but I'm in an old hotel, so I have no idea. Bottled water, so much of it is acidified. We add acid to it. So I'm not a big proponent of single-use plastic or of bottled water. But here I am drinking this, and the pH may be as low as a Mountain Dew. It can be. So you're getting acid coming in, and then 60% of Americans have acid reflux, including many kids. And so the acid coming up from the stomach, which is a whole other conundrum we should talk about sometime. But the acid in the mouth causes the calcium on the teeth to buffer the acid by releasing calcium. Your teeth should never give up calcium. You should have them your whole life intact. Cavities are a sign that something's wrong. It's the canary in the coal mine, if you will. So
I thought I was also, you bring up sugar, and we are a very healthy household, and I don't give them gummy snacks that much. Or the occasional, it's a treat for sure. And we don't drink sodas, and we don't, she doesn't have a ton of juice. But then what her dentist was telling me was, well, does she eat goldfish? I was like, well, yeah, every toddler eats goldfish. And she was saying that that's what could be sticking in her teeth, the crackers. And
white flour does act in a way. It's a carb substrate for the strep mutans. But keep in mind that all processed food these days has some sugar added, and the food industry does it. I hate to tell you this because it increases consumption. It really changes our orientation to hunger. It messes with 2 hunger hormones called ghrelin and leptin. So really the processing of that, I agree with her that I mean, if you can stay with real food, if she could eat peanuts instead of goldfish, I mean, stay with foods you recognize instead of ultra processed food. I know that's a big ask for parents. It really is. But we should not let the food industries win. As our health declines and our weight and obesity and diabetes and non-alcoholic fatty liver disease, 25% of kids today have non-alcoholic fatty liver disease. They've never had a drop of alcohol. And it's from the fructose, because when we rearrange the sugar, our common sugar to high fructose corn syrup, we doubled up our fructose. That can only be processed through the liver. And because pediatricians don't check ALT levels on kids, they don't do liver panels, we're not catching it until these kids are pretty sick. So yeah, just stay away from ultra processed food. I know it's harder as a mom and a dad to to buy food and to blanch or steam the broccoli or eat it raw, but I mean cut it up and get it in portions that they can grab and go and enjoy them and season them well. I mean, these are hard things to do as a mom, but they make a world of difference in terms of setting up a child's preferences for foods that are healthy.
Let's talk about braces, because when I was a teen, the typical routine was maybe 13, 14, we would start to see, I would see my friends in braces. And now I'm seeing really young kids in braces. And I know when we went, my daughter was 7, the first time she was recommended to go see an orthodontist. And I thought, does she really need braces? She hasn't lost all of her baby teeth yet. Are we too soon on this? But you're saying, yes, we should
Well,
be?
75% of kids today need braces from this crowding situation. Very funny. I'm 63. So when I was in dental school, which was eons ago, they told us that all the dental crowding we saw was from interracial marriage, that we had too big a teeth for our jaw size, and that when we got around to marrying our own kind, can you believe that?
Oh my
It's
goodness.
unconscionable that we believed that. But
Yeah.
the fact of the matter is, if you look back 100 to 200 years ago, our population didn't have dental crowding, and our genetic code hasn't changed. So what changed? Well, for one thing, ultra processed food. For another thing, my generation was almost exclusively bottle fed. And you have to suck a lot harder from a breast than a bottle. So our tongue, which makes up 16 muscles, got stronger and more robust. And the tongue reaches up in the palate and spreads the palate and creates a bigger box for the tongue, which means the arch length and shape got larger, enough to accommodate teeth. So low, lazy tongues and lack of chewing food. So going from sucking from a breast generally for a shorter period of time, rather than indigenous populations that were breastfeeding for 3.5 years on average. So, and then to sippy cups, and then pureed baby foods, and now pouches where they're just sucking. Their tongues aren't developed, and because of that, the facial muscles, the tongue sits low, and the facial muscles literally lean in and collapse that upper arch, and the lower arch contained, like within that box, everything gets crowded. So I'm on a rant with an airway group called Endeavor. It's a global airway group of about 25 of us that are experts in airway, to fix before 6. Even before they orthodontists will see them, like, how do we increase the palatal width and flatten that palate, which, by the way, is the floor of the mouth. Get these kids breathing 24/7 through their nose, not through their mouth. Get the tongue up on the palate where it belongs, preserve the arch length, and maybe not need braces at all. But that's an orthopedic movement, that expansion, not a tooth movement. So I'm guessing at 7, they wanted expansion for her,
Yeah,
which
that
means
was one of
which
the
means
recommendations.
they're actually trying to do a bony expansion of the mid-palatal suture, the 2 bones that fit together, and they're widening them out.
Hmm.
That makes sense?
Yes. So then when we're seeing that first phase of braces in the younger
It doesn't
ages,
mean the
that's for
last.
palate. And then later it's for teeth.
Yes, palate, and then we even do expansion of the lower. There's no mid-palatal suture that expands the lower, but to be able to take teeth that are tipped in even at 4 and 5 years old and upright them, as we have more room in the upper arch, we now have a bigger tongue box. In my most recent book, Brave Parent: Raising Healthy, Happy Kids Against All Odds in Today's World, of course, there's a whole big section on food, and one on drink, and one on microbial diversity and digest, some things we've talked about. But there's a big chapter on breathe, which is growing that tongue box. It has everything from pacifiers and a good latch when they're babies, and processed foods, and what's the whole hype with baby led weaning, is it okay or not okay, and all of that. as well as early orthodontics. I think a lot of the ortho we see today is preventable if we can do that orthopedic movement. And then the next chapter is sleep, which takes us right into sleep-related breathing disorders caused by the fact that we develop crowding in the back of our throat from mouth breathing and tonsillar enlargement, all because of this shrunk tongue box.
Oh my gosh. And what other development is affected by things like, tongue development, palate development, tongue ties? Does that affect any other development anywhere else in our children?
It affects everything because the airway is developing lower. So later, as you get older and lose some elasticity and in the tissues, things collapse and they develop obstructive sleep apnea. Some kids have obstructive sleep apnea too, but obstructive sleep apnea is really rampant. I'm like 26% of our population has it and only 4% have been diagnosed. And as you guys, we've all heard that it's deadly, it can be deadly. I just lost a 52-year-old patient from it who fell asleep on his way home from work, but he was CPAP intolerant and wasn't wearing it, but it's very tragic. And then of course the AFib and the heart attack and the 5 times increased stroke risk and dementia. So yeah, I think these early years where we can set them up for good structural stability. The other thing about sleep disorders is anytime we see restless sleep in kids and kids tired through the day and behavior, defiance behaviors and lack of concentration in school, these are all descriptors for ADHD. But 37% of ADHD is just a sleep issue. And if they're not getting enough sleep and they're diagnosed with ADHD, how do we medicate that? Well, we give them Ritalin or Adderall, these uppers, and that does not help with their sleep. So then we start to see a massive decline in these ADHD kids. I'm not saying ADHD is a syndrome. It's a collection of symptoms, and the symptoms look very much like sleep deprivation. So before you ever get a diagnosis of ADHD and put them on meds, it's a good idea to at least get a sleep study.
Yeah. Oh my gosh, great point. I also want to talk about, before we wrap up here, any sort of oral cancer and mouth cancer and how young we're starting to see those pop up.
Craziness. We are seeing oropharyngeal cancer especially in middle-aged men increase at 30% a year from HPV. HPV, human papillomavirus, is the #1 sexually transmitted infection in the world. And we see typically 50% of all those cases happen between like 18 and 26, I think, years old. So we're seeing a lot of young promiscuous behavior, which goes without saying, that's happening on college campuses everywhere, right? Not recognizing that oral sex is not safe sex. So we're really knowing that the average age of body part sex for kids begins, let's see, it's pretty young, like 14% of 13-year-olds and 41% of 15-year-olds have already participated. So we definitely want them vaccinated with the Gardasil 9. Oropharyngeal cancer is here and it's devastating. And because it's in the back of the throat and base of the tongue and the tonsillar pillars, you really can't see it. It pops out as a lymph node and all of a sudden you have this significant cancer.
Another big thank you to Dr. Susan Maples for her insight on our kids' dental health. You can find her book, Brave Parent, Raising Healthy, Happy Kids in Today's World, on Amazon, or you can go to her website. And we want to hear from you. We have started a Mom Squad Facebook page. This is where we're going to create our squad. It's going to be full of helpful articles, questions, and information. You can interact with other moms too. All you have to do, use the QR code on your screen to take you directly to that page. Thanks to all of you for joining me here on Mom Squad. We'll see you right back here next week.